Welcome friends. Today we will be continuing our discussion on the targeted drug delivery systems. We had seen the few basic aspects of targeted drug delivery. We will be looking today to organ specific or organelle specific targeting strategies so as to give you a better picture of how targeting strategies can be taken for better delivery of the drugs. Also, as we have discussed a lot of times, that this helps in reducing the side effects as well as the dose of the drugs. So we will continue our discussion today on the targeted drug delivery systems. So today's objective would be looking into why these targeted drug delivery systems are essential, because we have discussed it a lot of times that they help in improving the therapeutic efficacy and minimize the systemic toxicity, especially in treating tumors, brain disorders, liver diseases and infections which are localized in macrophages, lymphatic tissues and bone marrow. Also, we'll learn about various approaches used for organ-specific targeting using polymeric carriers, liposomes, microspheres, prodrugs and antibody enzyme conjugates. Also, we'll identify the physiological and anatomical barriers like BBB, tumor vasculature and extracellular matrix, which basically pose a barrier to the targeted delivery of drugs. Also, first pass metabolism is one of them which hinders the effective drug delivery, and we look into strategies which are being developed to overcome them. Also, key molecular targets like surface receptors, adhesion molecules, transporters and specific mechanisms like receptor-mediated transcytosis, endosomal escape and prodrug activation that facilitate selective targeting and intracellular delivery will be discussed. So, the targeted drug delivery systems to organs is what we will be discussing first. So, in this case, the modern therapeutic strategies aim to deliver drugs selectively to diseased tissues or cells while sparing the healthy ones. That is what is the objective of targeted delivery. Now, the targeted chemotherapy to tumors is basically based with the goal of the tumor therapy to ensure that the agents are directly interacting with the tumor cells while minimizing the harm to the healthy tissues. Cytostatic agents primarily act by interfering with the cell growth mechanisms, while immunotherapy strategies rely on immune effector cells to selectively destroy the tumor cells. However, approaches which include inhibiting tumor angiogenesis, thus disrupting blood supply, are also being looked at. Chemotherapy remains a widely used treatment modality, but targeted drug delivery systems are necessary to reduce the systemic toxicity and enhance the therapeutic efficacy. So, carriers which are employed for tumor specific delivery include polymeric carriers, lipoidal colloidal carriers like liposomes and immunoliposomes, and microspheres. These carriers are often designed to recognize specific epitopes or receptors which are uniquely expressed on tumor cells for selective accumulation and drug release. The successful targeting requires bioactives to cross the tumor blood vessels, which consist of endothelial cells and the basement membranes. The tumor vasculature poses physical and biological barriers to drug delivery, prompting research into ligand targeted strategies that bind to molecular determinants rather than relying solely on the passive diffusion. So, vascularization and localization strategies. So, the tumor vasculature is highly disorganized and heterogeneous with many vascular shunts and irregular vessel diameters. The density of functional vessels is lower compared to normal tissues, and perfusion rates vary across different tumor regions. Vascular permeability, total blood flow and vessel diameters influence carrier accumulation and drug uptake in the tumors. The central regions of tumors are typically poorly vascularized, leading to reduced drug penetration, while the peripheral regions are more accessible. So, the barriers which are thus offered by the tumor vasculature must be overcome by the drug carriers. However, the anatomical barriers which are looked into for these strategies are the endothelial cell layers lining the blood vessels, basement membrane supporting the endothelial cells, and extracellular matrix surrounding the tumor tissue. Additional challenges include high interstitial fluid pressure inside tumor, low microvascular pressure hindering extravasation of the carriers. Also, permeability of tumor vessels is generally higher than normal tissues. These structural and pressure related barriers limit the efficient delivery of the drugs. So, the common molecular targets in tumors include addition molecules like the integrins and selectants, common receptors like insulin receptors, differentiation stage specific targets like the transferrin receptor, folate receptor, apolipoprotein receptors, and growth factors like EGFR, VEGF, vasculature markers like CD19, CD34, tumor associated antigens like TAAs. Now, prodrug approach is also used for tumor targeted delivery. As we know that prodrugs are inactive or less active pharmacological compounds designed to improve the pharmacokinetics like absorption, distribution, metabolism and excretion of the drugs along with site selectivity of the parent drug. This becomes activated by chemical or enzymatic transformation at the intended site of action. We have looked into the prodrug design and how it is converted into the active moiety in the previous lectures. Now, the importance of these prodrugs in cancer therapy is that the therapy demands high potency with minimal systemic toxicity. Prodrugs aim to reduce adverse effects by selectively releasing the cytotoxic agents at the tumor sites. Prodrugs, for example, designed to target hypoxic tumor cells through redox activation mechanisms are one of the examples. Now, tumor hypoxia, in the tumor interiors, the cells are typically hypoxic, low oxygen levels are there, which leads to upregulation of reductase enzymes. Hypoxia targeted prodrugs are reduced enzymatically inside the hypoxic cells, converting them into cytotoxic active forms. In normal oxygenated tissues, the prodrugs remain largely inactive, minimizing damage to the healthy cells. So, the concept has been explained in the table. Then, key enzymes involved in tumor specific prodrug activation are like the aldehyde oxidase, amino acid oxidase, then cytochrome P450, tyrosinase, then there are carboxyl esterases and many more. Now, the prodrug activation strategy involves selective enzyme overexpression. So, the tumor cells overexpress certain enzymes capable of activating the prodrugs. So, selectively those enzymes need to be chosen to activate the prodrugs. Tumor hypoxia utilizes the hypoxia activated enzymes. Then the lower extracellular pH, acidic tumor microenvironment used for pH sensitive prodrug activation. Then the tumor specific delivery systems like antibody directed enzyme prodrug therapy and gene directed enzyme prodrug therapy. The antibody directed enzyme prodrug therapy is a two-step targeted therapeutic approach for localized activation of the cytotoxic drugs. So, the list of enzymes and corresponding prodrugs used in the antibody directed enzyme prodrug therapy are mentioned in this specific table. Now, next is the brain targeting. So, the neuropharmacology, neurodegenerative diseases, their pathophysiology and the barriers which affect the brain therapeutics are the main things which need to be understood in the brain targeting. The BBB or the blood-brain barrier represents the major obstacle in achieving the effective drug concentrations in the CNS. Only small lipid-soluble molecules readily cross the BBB, limiting the therapeutic options for brain diseases. Disorders like diabetic neuropathy, amyotrophic lateral sclerosis, Huntington's disease and Parkinson's disease can potentially benefit from targeted delivery of the drugs. Effective brain-targeted drug delivery requires not only new drug molecules but also innovations in the drug transport capable of bypassing the BBB. So, the strategies for brain delivery of drugs are neurosurgical like disruption of BBB, intraventricular infusion, intracerebral implants. Pharmacological like chemical delivery systems, liposomes or nanoparticles. Physiological mechanisms like pseudonutrients, chimeric peptides and cationic proteins. Now, the limitations are there. Despite successful application in vitro, many neuroactive peptides, monoclonal antibodies and biological response modifiers fail in vivo due to their poor brain penetration. The pharmacokinetic limitations affect brain drug therapy in infections like bacterial meningitis, viral encephalitis, and in neurodegenerative disorders like Parkinson's and Huntington's. Extreme difficulties are faced in brain tumor therapy due to the impermeable nature of the BBB. Now, factors which affect the drug permeation across the barrier are plasma concentration, time profile of the drug, binding to plasma and tissue components, the permeability coefficients, and local cerebral blood flow rate. Next is the bone marrow targeting. The bone marrow consists of yellow marrow adipose tissue and red marrow hematopoietic tissue. Red marrow contains pluripotent stem cells responsible for forming all blood cell lineages. Self-renewal and differentiation capabilities of pluripotent stem cells allow continuous blood cell regeneration. Targeting delivery to the bone marrow offers therapeutic benefits for gene therapy, antimicrobial delivery, and stem cell modulation. The RES-rich organs like bone marrow efficiently uptake particulates via phagocytosis by endothelial and macrophage cells. Specific anionic sites on the sinusoidal endothelium capture circulating particles, facilitating bone marrow targeting. Also, adhesion molecules regulate the exit and homing of the hemopoietic cells. Next, the macrophage targeting. The macrophages are reservoirs of pathogens like Mycobacterium, Leishmania, and dengue viruses. The drug carriers such as liposomes and microspheres are designed to passively or actively target macrophages. The physicochemical properties of the carriers should be based on their surface charge, hydrophilicity, and composition and ligand attachment properties. Macrophages act as secondary drug depots, facilitating localized drug delivery at the infection sites. Now, in the case of lung targeting, the local versus systemic drug delivery has to be weighed. Most respiratory drugs are administered for local effects like ephedrine for nasal decongestion, beta-2 agonists for bronchodilation, inhaled steroids for asthma. Local delivery requires lower doses, reducing systemic side effects compared to the oral and intravenous administration. The respiratory tract can also be utilized for the systemic drug deposition, especially for peptides and proteins that are degraded in other routes. The routes for lung targeting are based on the circulatory route, that is parenteral administration. Drug reaches the lungs via the bloodstream. Inhalatory route, that is drug is administered directly into the respiratory tract. The lungs can act as either the final target for treating lung disorders or an intermediate stop before systemic delivery. The advantages of inhalatory drug delivery is that the large surface area, that is 35 to 140 meters square, allows absorption of even large compounds. Thin epithelial barrier and rich vascularization enhance systemic absorption. Low enzymatic activity in alveolar spaces minimizes the degradation of drug. First pass metabolism is not there, which improves the bioavailability. The aerosol and nanoparticulate delivery can be adopted. The particulate drug carrier systems like aerosols are used for local and systemic delivery. Large porous nanoparticle matrices ensure drug retention in lungs and prolonged release. Studies indicate that alveolar macrophage uptake decrease for nanoparticles which are less than 260 nanometer, improving the pulmonary drug therapy. Successful lung drug delivery depends on particle size and density, which influences the mass median aerodynamic diameter. Next is the liver targeting. So, for liver injury and fibrosis involve hepatocyte damage, Kupffer cell activation, and the ito cell mediated matrix production. Kupffer cells, being part of the RES, are primary targets for liposome encapsulated therapies. Antifibrotic agents, antisense oligonucleotides, and gene therapies can be efficiently delivered using the liver targeted liposomal systems. Two main types of liposomes which are used are oligolamellar liposomes, that is membrane associated transport based liposomes, and small unilamellar vesicles which are aqueous phase encapsulated systems. Strategies aim to prolong the circulation time, enhance hepatocyte uptake while reducing the Kupffer cell sequestration. Then lymphatic targeting. Intestinal lymphatic targeting is promising for delivering hydrophobic drugs, peptides, proteins and vaccines. They have advantages like bypassing the hepatic first pass metabolism, selective treatment of lymphatic diseases, the enhancement of systemic bioavailability, and drug absorption via lymphatics relies on the chylomicron association following lipid co-administration. Strategies which are adopted for targeting are like prodrug formation, use of permission enhancers, surface modification, or use of lipid-based colloidal carriers. Colon targeting. So colon targeting also is important for treating both local diseases like inflammatory bowel disease, irritable bowel syndrome and colorectal cancer. It is also useful for systemic delivery of peptides like insulin, calcitonin and poorly absorbable drugs. How the challenges which are there are protection from gastric and small intestine degradation, ensuring site-specific drug release in the colon. Approaches are like transit time based system, pH sensitive systems and microbial triggered systems using polysaccharides like pectin, dextran and chitosan. So the polysaccharides which are used in colon targeting are like chitosan for colon specific matrix systems, pectin and pectin salts for enzyme triggered degradation in colon, guar gum, locust bean gum for biodegradable carriers for colon release, and dextran and cyclodextrin for bacterial enzyme degradation. So methodologies which are used for colon targeted drug delivery are drug carrier molecule conjugates like azo conjugates, cyclodextrin conjugates, dextran, gluconate, glycoside and polypeptide conjugates. Surface modified novel drug delivery systems based on polymer coating with pH sensitive polymer or biodegradable polymer, embedded systems, time release systems, bioadhesive systems and osmotically controlled systems are being used. So the moieties which are used for colonic delivery for local and systemic effects are for colon targeting. The criteria for selection is local treatment for gastrointestinal diseases is possible, drugs poorly absorbed in the upper GIT, medications for colon cancer, drugs degraded in stomach or small intestine, avoidance of extensive first pass metabolism and targeted delivery system requirements. So these are the criteria for selection of the moieties for colon targeting. Drug categories which are used for targeting of colon are can be selected from the anti-inflammatory, anti-hypertensive and anti-anginal agents, anti-neoplastic drugs, peptides, proteins, nitroglycerin and corticosteroids. Anti-arthritic and anti-asthmatic drugs can also be delivered. Therapeutic molecules like the non-peptide drugs as well as peptide drugs can also be delivered, can be selected for delivery by the colon targeting methodology. M cell targeted delivery for antigens. Now M cells in the follicle associated epithelium of the pairs patches facilitate antigen transport across mucosa. Targeting M cells improves vaccine delivery across mucosal surfaces. The strategies involve using lectins for addition to mucosal carbohydrates or ligand receptor targeting specific to M cell surfaces. Pathogens naturally exploit M cells for invasion. The same pathway can be harnessed for vaccine delivery against diseases like hepatitis B, anthrax and influenza. Intracellular targeting. Many newer therapies for enzyme anti-cancer drugs require intracellular or organelle specific delivery. The cellular plasma membranes act as major barriers for large hydrophilic or charged molecules. So two major intracellular delivery strategies include direct entry into cytosol using cell penetrating peptides or endosomal escape mechanisms using pH sensitive carriers. So cell penetrating peptides help in direct cytosolic transduction without endocytosis. pH sensitive liposomes can help via vesicle destabilization at acidic pH, and cationic nanoparticles can be used by membrane destabilization and endosomal escape mechanism. So for cytosol specific drug targeting, the objective is to achieve not just cell specific drug delivery but precise intracellular targeting to specific compartments. Cytosol, nucleus, mitochondria will have maximum therapeutic action. The barriers which are there are lysosomal degradation. So ligand drug carrier complexes often end up in lysosomes post endocytosis, where they are degraded by the acidic enzymes. Membrane impermeability. Most drugs, especially hydrophilic macromolecules, cannot freely cross lipid barriers like lysosomal or plasma membranes. Essential features for an ideal drug carrier are that they must bypass the physiological barriers like mucus, endothelium and lysosomes. They should be highly specific cellular recognition via receptor ligand interactions, and site specific drug release should be there at the target cells or their compartments, not extracellularly or in non-target cells. The attributes for successful formulation for targeted intracellular delivery are: there should be specialized ligands or recognition molecules, there should be compartment specific modules, non-immunogenic and non-toxic nature should be exhibited by the carriers, and sterile and apyrogenic manufacturing feasibility is there. Strategies for cytosolic drug delivery are: cytosolic delivery strategies are broadly classified into two main categories. One is direct entry into cytosol by bypassing the endocytosis, entry via endocytosis followed by escape from endosomal compartments before degradation. So the need for the direct entry of the cytosol is because large biomolecules, example DNA, proteins, cannot survive the acidic and enzymatic environment of the endosomes and lysosomes. So the solution involves use of cell penetrating peptides which enable direct cytosolic translocation. HIV TAT, which is rich in arginine residues, ensures efficient translocation across the membranes. Similarly, peptide from HSV VP22 facilitates intracellular protein spread, and ANTP from Drosophila transcription factor contains basic amino acids enabling cell membrane penetration. Mechanism involves a protein transduction domain, a small highly basic peptide motif that interacts with the negatively charged cell membrane, and energy dependent internalization occurs even at 4 degrees centigrade, suggesting non-endocytic direct membrane translocation. The applications are delivery of therapeutic proteins, peptides, nanoparticles like quantum dots and liposomes, improved intracellular bioavailability for otherwise membrane impermeable agents. However, there are some limitations also, like some cell penetrating peptides require pre-treatment or structural modification for efficient delivery. Risks of non-specific uptake by non-target cells if ligand specificity is not tightly controlled. So the advances which have been made in this are being mentioned in table 4, wherein PEP-P peptide delivers proteins and peptides without requiring protein denaturation or cross-linking. Efficient endocytosis independent delivery is there. TAT-P modified liposomes, attachment of multiple TAT peptides to liposomes enables cytosolic delivery and stability for 1 hour post entry. The PG linkers like p-nitrophenyl carbonyl PG facilitate stable conjugation. Now entry by escaping the endosomal compartment is also there. Fusogenic peptides and proteins are used. So wherein the problem arises because the endocytosed therapeutic agents face destruction inside endosomes, lysosomes, unless they are released rapidly into the cytoplasm. So the leverage fusogenic proteins to disrupt endosomal membranes under acidic pH conditions are of benefit in this case. The fusion peptides undergo pH triggered conformational changes at the acidic endosomal pH, inserting into the endosomal membrane and forming pores or rupturing it. So the applications include the Sendai virus F protein has dual functions like galactosylated ligand for specific receptor targeting and membrane fusogen for endosomal escape. Virosomes, fusion of viral proteins with liposomes improves in vitro cytoplasmic drug delivery. Now, delivery to the nucleus, it's important because successful gene therapy requires delivery of nucleic acids into the nucleus. Nuclear membrane and pore complex act as stringent barriers. These strategies involve mimicking the nuclear transport pathways used by viruses and incorporating nuclear localization signals into carriers to promote active transport through nuclear pores. However, efficient endosomal escape and microtubule mediated cytoplasmic transport towards the nucleus must be ensured. Mitochondrial targeting. The mitochondria are central to cell survival, metabolism and apoptosis. Thus, they are important therapeutic agents in various diseases. The diseases linked to mitochondrial dysfunction include diabetes, cancer, neurodegenerative diseases like Alzheimer's, Parkinson's and aging. So, these steps include surface delivery, use of cell-specific ligands, ensure carrier binds only to desired cell, then intracellular trafficking occurs wherein the carriers efficiently enter the cells and navigate to mitochondrial vicinity. Mitochondrial translocation occurs, which is final target via mitochondriotropic signals or molecules facilitating membrane penetration. The physiological events of mitochondria and disease association have been mentioned in table 6, like free radical generation creates oxidative stress and degenerative diseases. Calcium homeostasis disturbance causes dysregulated apoptosis and cell death. Release of signaling molecules, promotion of programmed cell death occurs. So, in most of the cases, cell destruction, apoptosis are the final outcomes of the disruption of the mitochondrial functions. The approaches include designing mitoconjugates, conjugates linking drugs directly to mitochondrial targeting sequences, DQ azosomes, vesicular systems formulated using dequalinium chloride with inherent mitochondriotropic properties. So, the conclusion is that the site-specific delivery of bioactive agents is important and is a major advancement in achieving better therapeutic outcomes for complex diseases like cancer, neurological disorders and systemic infections. Novel drug carriers and targeting ligands are efficiently addressing the physiological barriers, enhancing permeation across restrictive membranes like the BBB and tumor vasculature. Future advances will likely involve multifunctional systems combining targeting ligands, stimuli responsive elements and controlled release properties to achieve truly personalized and highly effective therapies. Thank you very much for your patient hearing.